Just to introduce myself, I'm Laura Cassidy. I'm the Network Delivery Manager for the Child Health and Wellbeing Network in the North East and North Cumbria, and I lead on the Healthier Together programme of work, working alongside Emma Lim, who's one of our clinical advisors who you heard from earlier. So I'm going to present on our Healthier Together Champions programme and give you a bit of background, I guess, in the context of how we've, as a region, ended up with kind of Healthier Together and utilising it as a resource. So, sorry, me slides for some reason are not deciding to move. So we're a little bit, I guess, just to give you a bit of context, the Child Health and Wellbeing Network is a function of the ICB, but we're currently hosted by NHS England. It was established in 2018, and we very much work across the whole of the North East North Cumbria footprint. And very much our vision is that of in the North East North Cumbria, we believe that all children and young people should be given the opportunity to flourish and reach their potential and be advantaged by organisations working together. And that was very much established through an event that was held to bring together professionals, children, young people and families to understand what they wanted of the network. And actually it was about sharing good practice and driving work forward to connect us with expert groups. And I think you'll know, we'll be aware, in the North East we have really significant challenges around health inequality and poor outcomes for our children and young people. So as a network, we have 10 priorities, which you can see, and I think it'll be no kind of shock to people. It's probably what we're all working towards and trying to improve in those areas for children and young people. As a region, we're actually quite a very big geography, so we have 13 local authorities within our footprint, and obviously that brings challenges in itself around kind of driving new models of innovation and really ensuring that we embed that across all of our region. And actually, we know that children and young people within each local authority account for around 20% of the population. So we actually funded Healthier Together through what's an NHS England integration centre bid, and it was part of Children and Young People's transformation. And our aim of our integration centre is about connecting expertise and relevant organisations, and we do that as well with the support of our integrated care fellowship. So like Emma is one of our clinical advisors. We have a data and digital fellow who supports the work. And as one of the largest integrated care systems nationally with the highest poverty levels outside London, we wanted to be able to deliver multiple integration models at pace to benefit large number of disadvantaged young people. So why Healthier Together? Obviously, we adopted it as a model of good practice from the work that was developed by Sanjay and his team in the South, and we knew that we needed to impact on our significantly higher rates of A&E attendances and some of the challenges that we talked about earlier, what drives people, whether that's their close proximity to hospitals or kind of that parental anxiety. And we know that children and young people account for around 25% of our A&E attendances. So, as part of the work that we've done to drive forward and get the Healthier Together information out to our communities, we decided to develop a programme called the Healthier Together Champions programme. And this was around working with our voluntary and community sector organisations to upskill staff and volunteers to become champions within their organisation and to be able to deliver the information around Healthier Together and actually show parents and carers how to download the app, how to utilise the app, how to use the website, and actually what it was for and how it could impact on them. So we offered out grants up to £5,000 to support capacity within voluntary sector organisations to be able to kind of, be able to do events, be able to get materials and do other things around the work that we're doing around that. So we had 60 organisations who submitted, and of that 18 organisations were funded. And we kind of did this on a tiered basis around looking at where the organisations were in relation to need as well, and geographical footprint, where we knew we had kind of higher admission rates and attendances. So we were kind of staggering that in an approach that as we put the funding out to the organisations. We had a clear ask of what we wanted the Healthier Together champions to do. So they were expected to attend a 2-hour virtual workshop to find out about the Healthier Together resources available to them and how you could use the resources within their existing activities. and we wanted them to work with parents and carers and families and young people in communities and share the resources in a way that was meaningful and accessible to their needs. It was about supporting and encouraging families and parents and carers to really to use Healthier Together website and to support them to download the app and register their children on the app. And it was also about supporting and encouraging as many new expectant parents in our communities to access the Little Orange Book resource online and in hard copy. And then obviously there was lots of work around utilising their own social media mechanisms to also support out and promote out the resource, but also kind of drive messages forward as we were sharing them through our social media. We asked them as well if they could submit regular updates of the work and how many kind of numbers that they'd reached and any good news, case studies, and provide feedback to us as a team around any improvements or future developments we could kind of add to the website, what was gaps and things like that. And it was about also past the funding of the expected couple of months of delivery that we'd asked from them for, was to actually share any ongoing commitments. So for a lot of organisations, that was that they would just continue as part of their day-to-day work to promote the resource and via their social media outlets. So this is just a few examples of some of the feedback from the organisation. So Bright Futures is an organisation which is based in the South Tyneside area in the North East, and they work with young women up to the age of 25 to give them a bright future by helping them to tackle some of life's biggest challenges. So I think it's clear that obviously from a voluntary sector community organisation, as we discussed earlier when we talk about hard to reach, we actually don't use that word. We use the word underserved communities because actually it's sometimes that we don't take the services to them. And actually this was by working with the voluntary organisation who work with our communities and are working directly with a lot of those people that we are terming hard to reach, we can actually get the information to them. So they hosted lots of events and used their social media, which has over 500 members. They also trained up further staff in-house, so ended up with 18 in total Healthier Together champions. And they utilised the business cards, which a lot of people feedback are really useful to give out as you're discussing Healthier Together, because people can tend to keep them in their purse. And then we also, as part of our Healthier Together work, we do lunch and learn sessions. And as part of being involved in this, they learned about the lunch and learn sessions and attended a one that we did focused on sleep, which they then utilised to do a session with the young women that they work with. And it was obviously, they also captured feedback. And this just gives you an example of a case study that they shared with us, so of a young lady who attends Bright Futures and has always struggled with her mental health, and at a lowest had contemplated taking her own life. So there was lots of mental health challenges for this young person, and actually it actually severely declined during pregnancy. And obviously as part of her support, she was attending Bright Futures. And actually she found that bedtime is very challenging, and actually the sleep session that they did at Bright Futures through the information they'd learned as part of our lunch and learn session had really helped her following that session. But then actually what she also found that is, obviously she's found that the Healthier Together resource has gave her the confidence as well to actually manage a child's illnesses, and much more confident, and kind of stopped her going to A&E that she probably would have previously. So this was just some of the feedback as well, some quotes from some young people around how they feel after they've obviously been introduced to Healthier Together. So I think it just gives you a flavour of how, you know, the voluntary community sector can be a real asset in supporting and getting information out to our communities. Another example, which I think gives you a bit of a different slant, and I think there was a mention to it earlier about how we can support school attendance through Healthier Together. We actually funded a West End Schools Trust, which is a charitable company of 8 primary schools in the West End of Newcastle, which has very high levels of inequalities. And actually, you know, they had a reach of over 3,000 families. So this is just a couple of the feedback case studies that they'd gotten in relation to the work that they'd done. So one of the parents was obviously supported to use Healthier Together for a daughter about a very sensitive female issue, and actually probably wouldn't have spoken to, or was quite embarrassed to actually go to the doctor. And that was around some of the cultural barriers for that mum. So actually the advice was very useful, and there was clear, they found it very clear, and the guidance on what to do next, and it resulted in the parent accessing pharmacy support only. Then parent B, and I think this is where we can obviously really promote within education system, is that one of the children was a persistent absentee and was kept off school regularly due to minor illnesses. And since they were introduced to the Healthier Together app, the schools actually noticed small improvements in that child's attendance. So it's really about giving those parents access to the right support and right information. I'm just going to finish off with one more, because I think this shows the diverse range of kind of organisations that we funded. So Rise North East works very across sector across the North East, and it's very much focused on how physical activity and movement can be introduced to help parents and families. So it's a big focus on physical activity and promoting that. And actually, they were one of the larger organisations that we funded, because of obviously the great reach that they had as an organisation. So they did lots of promoting Healthier Together through their newsletters, but also through conferences that they hold to frontline practitioners. So they'd work directly with early years practitioners, so they were able to cascade the message even wider. And they obviously, through that, they could have a broader reach to a lot more families as well. And this just gives you kind of the reach around social media as well. So they've obviously got quite a high following, and we're able to obviously drive the comms forward around Healthier Together. This is just another example of one of our organisations.
I may need you to stop in the next kind of 30 seconds.
No problem, I'm nearly done. So this is just a last example of where one of our other organisations were doing it as part of the Holiday Activity and Food Programme, and it just gives you that example of, obviously they've put a decal on the van in relation to the wider promotion of Healthier Together. So just a little bit on our stats. Obviously, we've seen a massive jump in Healthier Together usage with the Strep A outbreak, and actually we were, our growth was quite small. We've had a lot of challenges around support from the communications perspective, with obviously being hosted and sitting in a different organisation, and as the ICB was forming. But as you can see, as we've started to we saw a drop, and then we saw a drop again in February, and we've started to see a steady increase, particularly over the summer months, which is when a lot of this activity actually went live with organising through promotion. And just a little bit of coverage. So what have we achieved? We've got over 150 Healthier Together champions trained across 18 organisations across the whole of our footprint. We've created a network of champions to promote Healthier Together in our underserved communities, reaching around 10,000 families. And we've also gained positive and negative feedback, which is now allowing us to adapt and shape Healthier Together resources.